here waiting, and she's not getting up. And some of the staff go to her, and they're looking at her, and she's not moving. They pull out a pen light, see what's going on. Did she hit her head? Not moving. And they're checking for a pulse, and I said, oh, this doesn't look good. And then they started doing CPR. So, I mean, I was literally like from here, to that clock. And I thought, well, I probably should step in because these are mainly residents. So I went over there, I said, hey, I'm an ER doctor, what's going on? And they said, we don't think she has a pulse. And so went ahead and started CPR and, got that rolling. We did hands-only CPR. We didn't have any kind of protective barrier or things like that. And I said, look, it's a young girl, young lady, we need to get an AED right now, and someone go get it. So they ran to the one person ran out to the medical tent to go get it. In the meantime, someone notified HB paramedics, and probably about 3 or 4 minutes later, they showed up, which was great. And I said, put her on the pad, put the pads on her. And she was in BFib. So easy, let's just shock her. Shocked her, nothing. And I said, shock her again, nothing. I said, you know what? I know we're supposed to keep going, but just shock her again. This is what she needs, shock her. And she didn't come back. So we're doing CPR. And we do it for another minute or two, and I said, just shock her again. That's what she needs. And we shocked her 4 or 5 times, and she would not come back. And you could imagine, probably because of her acidotic kind of state, it was going to be tougher to get her back. And probably a lot of ischemia, she had a lot of strain on her heart. Well, anyway, we were doing CPR, and I said, look, let's get an IV. So we're probably now about 7 or 8 minutes into this, okay? But she had gotten CPR the entire time. And I asked HB paramedics, because they were trying to get an IV, they couldn't get one. And I said, do you have an IO, an easy IO? And they said, yes. So I said, pull it out, let's use it. And so they pulled it out, and I asked the gentleman, have you used it? He said, I've trained on it, but I've never used it. And I said, okay, well, let me take it. So I took it, and I started prepping her shoulder, the humerus, okay? And right away, the gentleman said, hey, what are you doing? And I said, well, this is where you're supposed to put it in for cardiac arrest. There's a lot of advantages over the tibia. And he said, well, we're not allowed to do that. And I said, I know, but I can. And he said, you know what, this is your patient now. I said, yeah, that's fine, it's my patient. So I put it in, gave her epi and amiodarone. And a minute later, we shocked her, and we got her back. All right? Now we're about 10 minutes into the code. And at least we got her heart rate back, she had a good blood pressure, but she wasn't waking up. And so I was really nervous about neurologic damage or something like that, So HB paramedics, we got her to the rig, and I know protocol is that I have to go with her, because I assumed medical care and I'm not supposed to relinquish it until I see another doctor. But I'm waiting for my wife. And I don't have a cell phone, she's not gonna know where I am. And so I said, hey guys, you did a great job. I'm sure you got it. I'll see you later. And they're like, no, you're going with us. So I went with her, and we got there, and Hogue was great. They brought her right in. They intubated her, hypothermia treatment, and got definitive access, and they went that route. And so, but what happened? Well, the good news is that 3 weeks later, she came to my ER to thank me. And I'm going to actually let her tell the story because she's here. So if you can just give me a round of applause.
Hi, thank you so much. It's a pleasure to be here and an honor. I had no idea most of this main details. Again, the first time I met him was probably 3 weeks after the incident from getting out of Hogue Hospital. So let me just fill you in on what happened after. So when I woke up, probably 3 days after, they brought me out of an induced coma. I was alert and they were really afraid. I had breathing tube down my throat, so I couldn't talk. So what happened was my sister and I, we used to do the alphabets and sign language to each other. So that actually really helped out, and they were asking me questions. Do you know where you are? Do you know your name? So I do in the alphabet back to her the answers to their questions. And you know, at that point they knew that my brain was okay, and I had some memory of who I was. So from that point on, I did a bunch of testing for the next couple of days, and at the end of the week they actually released me. And I took off a week from work, and thereafter I went back to work. One thing through this whole process is I was absolutely amazed how my father had became so involved with when I was in the hospital. And what he did was Dr. Kim had called to see my status, because when he took me to the hospital, I wasn't alert, and he was really, you know, concerned about it. Yeah, really concerned about me. So he got in contact with my father, who was able to give him updates on what was going on. So my father arranged for us to meet, you know, at Dr. Kim's hospital, and he was able to fill me in what was going on and just gave you all the information today. So I just wanted to thank Dr. Kim. I'm going to thank you endlessly, and also Huntington Beach paramedics. Thank you so much, and also the EasyIO, because if it wasn't for that, I wouldn't be here today.
Well, let me just ask her a quick question. So I know one of the things that came up while we were, I called her father the day after just to see what was going on, and it was funny because when I talked to him, he said, you know, thank you so much for saving her, but you know, the doctors tell us that she has less than a 5% chance of surviving. And I said, where'd you get that information from, you know? And I think it's because most doctors think that if you have CPR in the field, the likelihood is pretty poor, and it is, you know. But what they didn't know was that we did hands-on CPR right away, and then we got IV access or intravascular access right away. And I think the combination of doing things so quickly and HB paramedics doing such a great job that we were able to salvage 100% of her, you know, which is great. So, was there anything else that your dad told you about?
Well, I just can emphasize a little bit more that once they found out the news that I was in Hope Hospital, my whole family rushed over there, and at that point, that's when they actually told my family, you know, be prepared, because she's only going to have 2% chance to live. And at that point, they just, you know, were in hysterics, and they said that if I did come out, that most likely I wouldn't have any memory, or I might be in a vegetable state and so forth. So, you know, coming out of it was really rough for them.
Well, the good news is she came out unscathed.